Damo back in my usual Sunday night slot after a couple of weeks off. And in the aftermath of Rishi Sunak's budget and as schools prepare to reopen, health and education are very much the theme of tonight's agenda. To sift through the ramifications, I'm delighted to be joined by a panel consisting of nurse and NHS pay campaigner Siobhan Aston, independent SAGE member and president of epidemiology and public health for the Royal Society of Medicine, Dr. Gabriel, and my socialist telly co-host and Rotherham's finest, Sarah Grant, who will hopefully be joining me on a regular basis going forwards. Welcome to you all, and thank you very much for joining me tonight. How are you, folks?
Well, I think as well as can be expected.
Quite good this morning, yeah, quite good.
Brilliant. Well, the budget this week delivered a pay cut for public sector workers, including those in the health profession. Another pat on the back for a job well done, more claps, but scant reward for the enormously important job they do and have been doing over the last year especially. But a pay freeze, which they then turned into an offer of 1%, equating to a measly extra £3.50, I think it comes to. But combined with that freeze in the personal allowance and hikes to things like council tax coming, it's not much of a pat on the back. It still amounts to a pay cut and certainly won't attract people to those professions to fill the many vacancies there. Siobhan, you're campaigning on this. What has been the response to this from your colleagues and your union?
From my colleagues, I would say there is disbelief actually at the 1% pay announcement. For months now, we've been seeing on television Boris Johnson and Matt Hancock reiterating that they want to show that they appreciate NHS workers, that they want to make sure that we are paid fairly. And if I'm honest, I actually did have some hope that when the budget was announced that they would, because they certainly seemed sincere when they kept saying this. You'll see clips all over the media and they repeat these phrases continually. We want to show our workers they're appreciated in the NHS. They have stepped up in this pandemic and helped their country out. So there's outrage, there's anger, sadness, I think, from some people, because they have been given their all for it's almost a year now for a lot of people that have been working through the pandemic. Every nurse has a different experience, and even area to area that experience is different. But I think 1%, what can you say? It's just not, it's not acceptable.
It can't be, is it? It's insulting. Your union, I think, is asking for 15%, which is quite a big jump from the 1%. What's the reasoning behind that? Why are they pushing for 15%?
Okay, so the four major unions that I'm aware of actually all have slightly different asks. So I believe Unite and GMB are asking for 15%, so they back the grassroots campaign asking for 15%, whereas Unison and the RCN, Unison I believe is a flat 2k pay rise, and the RCN is 12.5%. So just to clarify, I'm currently with Unison, so my union has got a slightly different ask, but I back the 15% as a grassroots campaigner. The reason for it actually is because it was felt that this isn't actually a pay rise. The way that you view this would be it's a restorative pay award, because if you look at austerity over the past 10 years, NHS workers have actually lost approximately 20% of their pay. So we felt that that would be a figure that would, help to restore us back to where we should have been in 2020 had we not had the austerity.
Dr. Scally, that this situation with the nurses and obviously other health workers that's going on at the moment, it's not going to help this country tackle this COVID crisis going forwards if the health staff, the people on the front line, so to speak, are being treated like this, is it?
Indeed, one of the most remarkable things was that there was no mention of social care in the budget at all. Absolutely stunning, given what's happened to social care and the tremendous death toll there's been in care facilities for the elderly over the pandemic. And some of the social care workers are some of the worst paid in the public sector, with poor career prospects and very poor conditions in many cases. So all in all, I agree with Sarah. It was extraordinarily disappointing. I don't think it was surprising. We need to understand we came into this pandemic on the back of a health service that had been really diminished dramatically in the previous 10 years, so substantially. And the health of the population was reflecting that in many ways, with a real public health crisis. There was the life expectancy that we have been used to had improvement, had stalled. And in many aspects of public health and population health, things were getting worse. Life expectancy was actually dropping for people, particularly women, in the most disadvantaged communities. So we came into this pandemic in a bad way. The pandemic has taken a huge toll in many ways. It's taken a toll on the staff in terms of the exhaustion, and I think that there will be serious mental health problems and post-traumatic stress disorder amongst staff that will need to be coped with. It's taken a terrible death toll on the staff as well, with up to about 1,000 NHS staff, last time I heard a figure quoted, dying because of COVID-19, frontline staff. It's taken a terrible toll in terms of the diminution of the amount of care that has been able to be provided to ill people, people who absolutely need care. And that backlog of care will not go away easily. And rather than cutting, in effect, the budget from this last year to next year, which I find totally remarkable, it should be being increased, because we've got that backlog to deal with, and we still have got COVID to deal with, and we've got this huge problem of underfunding of staff pay for years and years and years. And all of that adds up to a really savage attack, I think, on the funding of the health services and social care.
I think there's a vocational aspect to this as well. I think that because you tend to go into the health service, or any public service for that matter, because you have this inherent desire to, in health, look after and care for people, or, you know, if you're a teacher, you've got a desire to teach people. Do you think there is a certain amount of expectancy on the part of the government that people in these professions will just carry on and accept this because this is what they want to do with their lives? Do you think they're deciding people are going to put their heart before their heads? To an extent?
I don't even think it's as sophisticated as that, as they have any thought at all. I just think they don't care, basically, about the NHS and about social care. I wouldn't give them credit for having any insight into the thing at all. And you just look at the amount of money that has been moved to the private sector, and continuing amounts of money being paid for a failed test and trace system, for example. And you can see the direction where money has gone and is going. So it all in all, I think it's just a continuation of the same. We heard a lot about austerity in the early years, particularly of the coalition government. And I never really believed that what was happening to the NHS was austerity. I always had the belief that what was happening to the NHS was systematic attempt to roll back the welfare state and public services. And I think that's been borne out. And when you look at some of the things that we're way behind on now, prevention as well, they're very anti-public health, I think, this government in its attitude. And we're now way behind in a whole string of immunization issues. For example, HPV vaccine, extraordinarily important that young people, young men and young women are vaccinated. And that will all have to be caught up with double running for at least a year. And how on earth is that going to be tackled with a budget that is the predicted budget now for the NHS, amazingly, for next year, is less than it was planned to be before the pandemic started. Less. How can that be? How can that be?
It's not justifiable. Sarah, did you want to come in on any of that?
Yeah, I mean, you kind of answered it, Gabriel. What I wanted to ask is, do you think this, obviously this 1% pay, whatever they're calling it, is obviously not good enough, but do you think it's all part of this long-term plan of this destruction of the NHS? It seems like they're still sticking to the plan, and this pandemic is just being used to fast track it, basically.
That's very much my view, and it's the reason, I don't know whether you know, but I quit my job. I worked for a strategic health authority and for the Department of Health, and I quit my job in 2012 because the Lansley reforms seem to me to be a straightforward attack on the NHS and a desire to roll back the welfare state in general. And I think that is what has consistently happened. And the health of the population is suffering, which is what I particularly care about. You know, I mean, I'm not attributing this particularly to any party political position, because for many years the Conservatives were part of a general consensus on the NHS. There was a general population consensus. And in fact, a Conservative government brought in the first public health white paper and set targets for improvement of health. And that is just so far from where we are now, where we have a government that is seeing health deteriorate before our eyes and is refusing to continue to provide money for the NHS, even to keep in pace with inflation. It's just an incredible situation. And we are seeing this real pressure on the NHS. And you can see, if you look at what's happened with the funding for NHS, so-called NHS test and trace being given out to private companies to do that, you can see what's going to happen. My view would be that the government is likely to put so much pressure on the NHS that it will start failing seriously in various places and various areas of its work. And the government will take that opportunity saying, oh, well, the NHS can't do this. We'll give it to McKinsey's to organise and Circle to provide and so on. So I'm very concerned as I ever have been, I think, in my career about the future of public health and the future of the NHS.
Can I just add to that? The main argument from the government is obviously that they don't have enough money to fund this pay rise. And when you actually look at the figures submitted to the pay review body, the cost of a fully funded 15% pay rise for all NHS staff is approximately 8 billion. Compare that to the 37 billion spent on Circle test and trace, an ineffective test and trace system. And just to follow on from what Dr. Scally said there, that is what happens when you start to outsource work that belongs within the NHS. It doesn't work. So we're actually paying more for an ineffective system than if we had done it in-house.
Yeah, when it's in-house, the NHS was funding itself. The moment outsourcing came in, a certain amount of that money then has to go to line shareholders' pockets and therefore is not being reinvested in the service. And you're always going to get a poorer service as a result of that. And NHS workers such as yourselves have been the front line in the fight against COVID, overworked and underpaid, lacking the correct PPE, not enough staff. And as you mentioned, the test and trace system, they've just been offered another 15 billion to add to the 22 billion it's already had.
Yeah.
And that's just part of a 111 billion pounds that has been handed to non-NHS providers by the government during the course of this pandemic. And when you're told £3.50 is all they can afford, it's got to be a difficult pill to swallow.
If I could just make two points, one about test and trace. I wouldn't mind in an emergency if it were done properly. I just wouldn't mind Circle or McKinsey. I would shake hands with McKinsey if they were doing a good job, with Circle if they were doing a good job, but they haven't been doing a good job. And partly that's because the operational model is entirely wrong. But more importantly, it's because they're not following the international guidance. In the midst of a pandemic, there is really good international guidance about how to put in place a fine test, trace, isolate, and support system from the European Centre for Disease Prevention and Control, from Centres for Disease Control in the US. And the UK is not following that guidance. The most obvious example being when people are at high risk, close contacts of someone who has tested positive, they are not tested. What happens is that they are told to self-isolate and come forward for testing if they develop symptoms. But we should be testing everyone and then tracing their contacts for those that are positive and finding all the cases. And we've never done that. Don't follow the guidance. Secondly, I think there's a broader issue here. I'm not an economist. I know a little bit about health economics, but not much about the rest. But given that public sector workers are some of the poorest paid people in this country, how is the economy going to keep going if you have this huge number of people who have no disposable income left? None. What will that do to the whole functioning of society? Because it's not that NHS workers or social care workers are putting it away in banks in Monaco or the Cayman Islands. They're spending it on their families on educating their children, on bringing up their children properly. They're spending it in their local communities. And that, if you don't pay people, they don't have money to spend in their local communities, and you're impoverishing everyone, and you're impoverishing our society. And how all of that squares with their slogan of leveling up, I don't understand.
No, I mean, I'm no economist either, but I think it's a well-known fact that it's people who have money that they spend on the high street is what causes our economy to grow, and it's not money being, rifled offshore by wealthy people that is going to keep the economy going. And obviously, these shareholders that a lot of this funding is going to will be the sort of people that are not going to be necessarily spending on the high street and helping to continue to that economy. But I look at this figure of £37 billion and I think to myself, well, what on earth could the NHS do with that sort of money? I mean, surely the NHS could have created its own track and trace system that would have worked, because 70 years of experience of providing healthcare as the NHS has got, surely they would know exactly what needs to go into such an application, and could have been done for a heck of a lot less money.
Oh, I think it could, and it's very simple to see how it could be done, because local authorities, particularly in England, have a director of public health, and they have a public health team. Now, it's not as big or as skilled or as well positioned within local authorities as public health should be and used to be, but it's still there. And the money should have been put into local authorities, and they given the task of developing, alongside their local NHS bodies, the full find, test, trace, isolate and support system. And myself and my colleagues in Independent Sage always talk about find, test, trace, isolate, support, because you can't pick things out of that. If I had someone I know very well who was doing some contact tracing in these islands, and they had just been on the phone to a young person who was working in a care facility, and they tested positive and they had to isolate. And this person lived in a household of 9 people. And she was one of them, with 1 bathroom and 1 kitchen. And between them, they were working in 5 different care facilities, and some of them were working in more than one. How on earth can you isolate in that situation? And what we needed was a good local system, so that if someone that came along said, well, how on earth can you isolate there? Here's where you should go, and we will look after you for 2 weeks until your isolation period is over. That's what it's all about. It's about finding the local cases, involving communities and community leaders and faith leaders as well, to put some community back into that whole process, not being some service being delivered by a remote call centre, or even worse, in Northern Ireland, they have a digital first system that it's called. So the only thing that people get is a text message. That's it.
Yep, nice and simple and straightforward. You would think it would be the obvious way to go, but somewhere along the lines, things have become rather complicated. There's a £35 million industrial action fund that has been set up by the Royal College of Nurses now. There were hashtags trending on Twitter yesterday consisting of NHS strike, NHS pay rise, NHS pay 15, pointing to that 15% pay rise request that we talked about a moment ago. As recompense for some 20% in cuts in pay that nurses have suffered since the Conservatives came to power in 2010. Too important to go on strike, but not important enough for an adequate pay rise is one comment I've seen passed on this situation. Do you think, Siobhan, that strike action is likely? And what will that look like for people concerned about accessing health services?
I think that strike action is a stronger possibility now than it has been for years. That's what I would say. The RCN releasing this statement is what I would say is a warning shot. They are showing their hand that we are prepared to take whatever action necessary at this point, because it's been going on for a decade, and especially after the pandemic, it's highlighted the importance of the work that everyone who works in the NHS does. So in terms of strike, I know one of the things that would concern people is, there's 2 immediate concerns that I see brought up frequently. The first one is safety. Now, before we even get to taking industrial action, a process has to be followed. We don't all just walk out the building. It won't happen tomorrow. These things take time. And strikes are actually planned for. They do look at, the government is given notification of when these things will happen. It all has to be done through a legal process. So that's the first point that I would make to people that are concerned about that. The second, if we're going to talk about waiting lists, because I know people have commented that to me on Twitter, they're concerned, would this just make things worse? I think they need to look at the situation we're in now. For example, in some places you're waiting up to 2 years for psychological help. The waiting lists are already atrocious. And if you compound that with the effect of the backlog due to coronavirus, what we really need is to invest in staff, to retain the staff that we have who are dejected, thinking about leaving. So really a pay rise is the first step towards improving services and working through those waiting lists and backlogs. And at the end of the day, it directly affects patient safety, because you need to know, if you're in hospital, that when you hit a call bell, there's going to be a nurse at the other end to answer it.
Yeah, sure.
You know, it's what it'd be, to me, it'd be unsafe not to consider taking these actions.
Valid point. Would you find yourself in agreement with that, Dr. Scally?
I would indeed. I think, and there is, for once, a complete unity, I think, across the whole health and social care workforce about the importance of this, because there are good reasons why we really need to take it seriously. Because of Brexit, the flow of people from other countries into the UK to support the NHS has well, not dried up, but it's certainly slowed enormously. And I think the era of us being able to recruit abroad and particularly plunder the health economies of developing countries is probably at an end, I hope. And there is a real issue about making sure that we are recruiting enough and expanding recruitment. It's a long time since the UK has produced enough doctors to serve its needs and enough nurses to serve its needs. Yet we know there are plenty of applications for medical posts, for medical training, and for nurse training, and for the other health professions that are just not, we're not able to take on some of the fantastic candidates we get, because we have underinvested, not just in the salaries to attract people in and to keep them there, but the just recruitment and training of people as well, completely neglected. And very often when money has been tight in the NHS, it's those training budgets and training numbers that have seen the cuts.
As from a perspective of somebody that's used the NHS quite a lot, we've seen quite a lot of degradation in the NHS over the years. If I explain a little bit about my story, I've got a daughter who has spina bifida. I've got 3 sons who were all born with cleft lip and palate. I was born with cleft lip and palate, and I had mine repaired in Plymouth at the time. I'm based in West Cornwall. Now, with all my children, they've all had to go to Bristol to have treatment, and the eldest of those children now is 18. At the time, they went to Frenchay Hospital and had all the repairs done. I know Dr. Scally is familiar with Bristol. Frenchay is no more. It's gone. We now have to go to the Children's Hospital for any appointments. I had to go to Bristol on Friday, actually, funnily enough, with my daughter for a checkup, all for a 10-minute appointment to come all the way back to West Cornwall. It's a 400-mile round trip.
Wow.
Because the services needed are not available closer to me anymore. We've seen this progressively as my children have grown up and they've been seen for surgeries and what have you. And I think people need to realise that we need to come out and support the NHS in the ways that you've outlined quite cogently today, because otherwise these services are going to become more and more broken down. We're seeing more and more, hospitals being taken apart. They're losing beds. They're being centralised, and things are not looking too good from the patient's perspective, as well as the staff's perspective, certainly, as we've spoken about already. Do you think it's time that the public became a little bit more proactive in supporting their NHS, and how would you suggest they do that?
Well, Damien, first of all, I should explain that I was very much involved in reorganizing the cleft lip and palate surgery services in the Southwest. And here you have the dilemma which illustrates why you need really good public health and good management, a good patient representative at the core of the NHS. We had across my region, as I used to be regional director of public health, the Southwest, but many other regions, a lot of different ENT surgeons in different hospitals doing the surgery. And they were doing the surgery on a very small number of patients each per year. And the outcome figures were not great, where we could get outcome figures, because they did so few cases. It was difficult ever to get a big series of patients. So there was a national review involving the National Patients Organization as well. And it was the patients who were one of the strongest supporters of restructuring the service. So that's what we did. We restructured the service so that the surgeons who were doing the surgery did plenty of that surgery. They did it regularly and they were highly skilled in it. They weren't just doing it from time to time. I remember getting told off for expressing it in exasperation one time, that if I was having an operation performed on me, I'd want it to be carried out by someone who is really specialized in doing that operation, not a talented amateur. And that didn't go down very well with some of the surgeons at the time. But what is really important, that you have a two-way process here. There are some things where we have to centralize to get them better for patients, but there are other things that we should be decentralizing because it's better for patients. And we should also be providing the sort of support and follow-up arrangements so that you don't have to travel. That's ridiculous, having to travel from Cornwall or Bristol for a 10-minute outpatient's appointment. It should be the staff that travel down to Devon and Cornwall to see a whole load of patients to save people travel time. And that's that's the way we should be doing it. There should be clinics across the country where people could be seen. But how does some of that end up? I think partly it's to do with democracy in the NHS and the absence of democracy now in the NHS. We no longer have local health authorities with kind of real people on those local health authorities, bodies meeting in public. There's a real lack of transparency now with a lot of organizations, trusts and others meeting in private all the time. And also we don't have proper public representation. If I just finally say, and I think that democratization of the NHS is really, really important. And it has let us down actually during the pandemic, because there is no command and control in England now from the centre to the periphery, because there is no local health body with a responsibility for the health of the population. It's all trusts of various sorts and commissioning groups. And therein lies the answer that, and there's NHS England at a national level at the other end of it. And most of the NHS structure has been reorientated towards commissioning and contracting, not running the services and planning the services. Planning is a word you rarely hear ever in the NHS anymore. When I started in a health board in Northern Ireland, there were 29 members on the health board, a chair and 4 sets of 7. 7 were staff representatives, 7 were local councillors, 7 others were the local good and great, and there was another group as well. But and I was the chief officer of it. I wasn't a member of that board. Once a month, I had to stand up in front of that board and talk about the provision of all the medical and paramedical services for the population and answer questions in public from those people, particularly the councillors. And that was democracy and that was accountability. And just show me, where is the democracy and accountability now?
No, this is very true. It has to be said, even though it's an onerous journey, the outcomes for all of my children have been excellent. All of them have had excellent repairs, and my daughter is walking, which they never thought she would be. So it's clearly, I certainly would never criticise the level of care and attention to detail that has been offered to my family. It's been absolutely
no, you're quite right, Damien. But that doesn't mean that you can't have lots of aspects of investigation and follow up and therapy devolved and carried out more local to where people need, because it discriminates against people who don't have cars, for example. And how do they get? And the amount of time people have to take out of their own working jobs, earning a living, particularly in a gig economy where they're paid by the hour. And all of that isn't taken into account. And the reason it isn't taken into account, I believe, is because we don't have enough democratic input into the organisation of the service, and we don't plan. I mean, you never hear the word planning anymore.
No. Now, Sarah has, she had a few technical hitches a moment ago, but she's typed in the chat. The government heeded the strike fund warning shot that the Royal College of Nurses sent, and we are now seeing the start of a propaganda war. What do you say to those people that say you should be grateful for the 1%?
Well, I would say that they are buying right into the government's hands with that response, because I think that is exactly what they're trying to achieve in the media. They're trying to, what I'm already starting to see happen is that they're trying to pit public sector workers against other public sector workers, you know, so it gets into a fight about who is more deserving of pay rises. Also, we've seen the argument private sector workers versus public sector workers. You know, if they aren't getting rises from their employer, then why should the NHS? I don't think it's a situation that we want to buy into too much. We've explained the reasons for why we think 15% is justifiable. I do think that the public now need to realise that if they don't stand for the NHS, then they're going to see it degrade further. And the whole idea is to retain an NHS that's free at the point of access, regardless of your income level. And I'm really gravely concerned about privatisation. I do think things are not as bad here in Scotland, but I see stories on a daily basis about things being outsourced. And it's stories like yours, you're saying you have to travel further for essential care. So I would say that this isn't just a war over NHS workers' restorative pay awards. This is also the public's NHS. It belongs to all of us, and we all need to fight to retain that. I personally think it is the best asset of the United Kingdom. And I know many, many people feel the same way. And there was actually a poll, I think, just announced last night about what support we would have if it came to industrial action. And it was a majority in favour. So I actually think the public are behind us. So maybe that's why the propaganda war is already kicked off, because the government knows after everything we've done, the public back us.
Yeah, that media campaign to help drum the government message through. I think it was an Observer poll, actually. 72% of people back the cause of the calls for a better pay rise, because they consider 1% to be too low. In fact, even amongst Conservative voters, 58% felt it was too low. So I think you are right. I think the public is on your side with this, certainly, and I certainly hope you managed to get somewhere with that. But of course, the pressures the NHS is currently under is not helped by choices that have been made beyond the immediate scope of the NHS, because for the third time, we're now looking at starting to come out of a lockdown that's beginning with the reopening of schools. And we're coming out of it with the majority of those fortunate enough to have now had a COVID jab only having had one of them, which, given these vaccines are designed to be administered over the course of 2 injections, brings into question the efficacy of just that single dose. And having spoken with one of your friends, Dr. Scally, and our co-host, Dr. Kailash Chand, the other day, there is a big question mark over the issue of transmission surrounding the vaccines and the different stages of having them. I know you've also been quite outspoken regarding the issue of quarantine, which has not been thorough, which has contributed to many cases and indeed variants from other parts of the world arriving here. And of course, that then knocks on to workers like Siobhan as one factor where we end up with cases of COVID to treat, which arguably we could say were completely preventable. Is vaccination, such as it stands right now, a game changer this time, or is the government set on making the same mistakes again with the same outcome of rising cases to come?
I hate the word game changer because it reminds me that this government has always sought the silver bullet. It's always looked for the one thing that would get them out of trouble. And you'll remember that I've lost count of them now. There have been so many. The app was one. Antibody testing was another. NHS test and trace, going to be wonderful. Lateral flow tests were going to solve all our problems. Every time they look for one thing to solve it, and often they are products of the medical industrial complex, really, rather than public health interventions. So that's where the focus of the government has been. And public health isn't like that. You don't deal with a public health crisis by finding the one thing that works, because there never is only one thing that works. It's a whole series of interventions and a whole series of additive interventions, and sometimes synergistic. Sometimes they multiply in effect. So you do everything. So let me be quite clear. I think the vaccination program, the development of the vaccines has been fantastic. I think the vaccination program has been superb. One of the reasons why it's been superb, of course, is that it has been run through the NHS, and the NHS has done it superbly well. What a pity they didn't get a chance to do NHS test and trace in conjunction with local authorities. It would have been done so much better. But I do worry that about the variants. You're quite right. Variants are enormously worrisome. And the only way to cope with variants is to the mantra of three things that I say these days: that we've got to get the number of cases down, we've got to get it down, we've got to keep them down, and we've got to keep them out. All of those three things together with vaccination will get us through this, and it'll get us a long way through, and it will also prevent us developing more of our own variants, because if the virus isn't spreading, if it isn't developing, if it isn't infecting people, the virus doesn't get a chance to mutate. So I still hold that we should try and get the numbers down as far as we can. I don't think the government has any interest in doing that, however. I think Scotland, however, has been fantastic in saying that Scotland wants to take a zero COVID approach. And they're quite right. And I think it makes the case for more powers for Scotland to be able to do that and look after their population properly. So I think we're a long way from this being over. And I really worry about it being yet another time when health inequalities will be to the fore and will be amplified by it, because we know from the vaccination results so far that there are a lot of communities where the vaccination rates are not as high as they need to be. Anyone can get a vaccination program to 70 or 80%. Getting it into the 90% is really tough. Getting it up into the 90s is tougher again. And that's the long haul, and that's where the local effort is required. And we're not there yet. And we know when we came out of the last lockdown that it was the local authorities, particularly the 4 local authorities in the Northwest. When we came out of that lockdown, there were 4 authorities where the virus was still spreading widely in those communities, and they were local authorities that had a high level of deprivation, a high level of housing overcrowding, and a high level of people from BME backgrounds. And I think yet again we will see inequalities in the vaccination program, and see maybe amplified inequalities in terms of the spread of the virus in some of the outbreaks we will inevitably have. And I think that's really difficult because we don't have the kind of people, the public health workforce on the ground in the NHS and local authorities to be able to deal with outbreaks popping up everywhere. So I think it's a really rocky road.
Yeah, it's been put to me that without the numbers coming down adequately, that it's comparable to not completing a course of antibiotics, in that you're not squashing the virus, you're not beating the bugs, so to speak. You are putting it under pressure, and that encourages these variants to mutate and come into being. Surely the government should have learnt by now that this is what's happened before, when we saw that variant in Kent, and of course we've seen other variants in other parts of the country as well, and other parts of the world, in fact, that this is a mistake they're repeating, especially in light of the fact that with schools reopening and them being the single largest vectors of transmission, as they called it, and with teachers having not been prioritised for vaccination, that this is where it's going to stem from all over again.
I think schools are an enormous worry. And there is, of course, no vaccine approved yet for people under 18. And So it's going to be a huge kind of reservoir of non-immune people, these children and young people in school. And there is a real difficulty, especially bringing the way the government is doing it, intending to do it, bring everyone back across England into all the schools all at once. I think that's just remarkable. And it's remarkable because what hasn't happened is that there hasn't been a program of work with those schools to make things safe, to make them COVID safe. And by that, I mean things like ventilation. I think ventilation is extraordinarily important. We know that this variant that's dominant now is even more infectious than the previous one. And we know it's spread by air. And we should have had a whole program of works aimed at improving the ventilation in all our schools, making sure it was up to scratch in all our schools. That, and the contrast with elsewhere is remarkable. If you're a parents with a child in the public health school system in New York City, you will have a report available to you on your school. You will be told the number of the classroom that every room has a unique identifier. You'll be told the number of the class that your child will be in, and you'll be able to read the report on the ventilation of that room, whether it's got windows, whether those windows are capable of being opened, whether there is a ventilation system which extracts the air from the classroom, whether there's a ventilation system that pushes it into the classroom from outside, whether there's a mechanical ventilation system, an air conditioning system, whether there's a filter on that air conditioning system, and how effective the filter is likely to be against virus. All of that you will have at your fingertips if you're a parent. And what we haven't seen is the program of works that I would like to see, which is taking over other community facilities, halls, unused facilities at the moment in the hospitality industry or conferencing facilities, or putting up temporary buildings which could be well ventilated, to give classes more space so that they're better spaced out and the buildings are better ventilated. And I would also like to see them do things like a staggered return, and also have hygiene standards. We know it happened in the NHS. I remember the time when we were taking wash hand basins out of wards in the NHS because it was regarded as no longer a problem. That was before we had a lot of problems with MRSA in hospitals. But we need good hygiene facilities. There should be improved hygiene facilities, hand washing facilities, for example, in all our schools. And we should be seriously looking at mask wearing for all children over the age of 6 as well. And good masks, good quality, provided free, suitable for children to wear, and with good instruction on hygiene, on ventilation, and all of the aspects of a safe school for everyone. And I absolutely support the immunization of teachers. I think schools are so important for children and we should be doing it properly. But I haven't seen, I'm sorry, any sign of a program to do it properly.
No, I agree. There was nothing else in the budget, funnily enough, for education either to fund the proper masks or the proper formula for hand gel to help combat this in schools. I completely agree with you that it actually should be provided by the schools. It's all right with people in the community making lovely, beautifully patterned face masks for children, and there are some people who produce some lovely ones, but we have no idea what their efficacy would be. Siobhan, you've heard the news about the potential opening of lockdown again as well, and starting with the schools reopening. What's your feeling as a nurse? What has been the conversations you've had with colleagues? What are you expecting to result from this?
That's difficult to say, because I think we'll need to see the effect that the vaccination programme is going to have, because we're in a different place from when our last lockdown was released. One of the key messages I would have got across is that I think we should have vaccinated our teachers. I don't understand the logic in sending our teachers back into classrooms with 30 children at a time. No wonder they're angry. I mean, I've tweeted on this quite frequently, actually. I really feel for our teachers, and it's important we show them some solidarity, because as NHS workers, we don't want to see our teachers getting sick because they're put in these situations. So in that sense, You know, that's something I think should have been looked at urgently before we rush to reopening schools. In terms of the release of the lockdown, look, we acknowledge how difficult these lockdowns are, and I think people need to appreciate they are difficult for us as well. Yeah, I've had some human interaction because I've been going to work throughout them, and some people maybe haven't been because they've been furloughed. I understand the public's frustration at lockdowns, but they are necessary until such a time as we get on top of this or have a better strategy, or the vaccination programme has been more widely rolled out. I wouldn't like to make predictions. It's out with my speciality, to be honest, to make those kind of predictions. But that's my personal feeling, is let's vaccinate our teachers and let's do it quickly. I think we can do it. I believe the NHS can do it, and I believe we can do it quickly.
I believe you're right. I think it's absolutely something that should be, it should have been prioritised long before now. It just seems like. Sarah, do you want to come in again?
Yeah, what I want, in addition to the kind of physical risk with regards to the schools reopening, one of the things that's concerning me also is the mental health of young people at the moment. I mean, particularly teenagers, and I've got a 6 and 8 year old, and now, you know, their mental health has been affected by this kind of stop the government is enforcing on everybody rather than doing it properly the first time. What should the heart of people's mental health?
Yeah, mental health in students. How do you think that's?
I do think it's a really serious issue. I said earlier I am worried about the mental health effect of all of this on NHS staff and frontline staff in general, and I think that applies to young people as well. There are young people who have coped very well with homeschooling, but there are young people who haven't. And I don't think that's evenly distributed across the classes at all. I think there are a lot of people in deprived communities who can't afford all of the what should be the essentials of homeschooling: really good broadband access, really good computing facilities, support on tap regularly. All of that sort of stuff hasn't really been addressed. Which I don't understand why not, because it should have been. And I do worry about mental health. But we got to remember, and I'm sure you'll be aware, Sarah, that this comes on the back of a real problems in child and adolescent mental health services that's been going on for some years, extraordinarily difficult times. And we do need help, and we should have had a lot of money allocated in the budget for precisely that purpose, additional money for schools. So that we could deal with those very, very important issues in the aftermath. I mean, it is going to be a problem. One of my real worries at the back of my mind always about them going back is that if the virus spreads amongst schools, that people will think this is harmless. But we know that there is some evidence from ONS that actually in school children who get infected, that there is a very significant incidence of long COVID. And their estimates, and they are just estimates, are that at primary school level, 1 in 8 children who get infected will have long COVID, i.e. symptoms 5 weeks afterwards and beyond, and 1 in 7 at the secondary school age group. So it's a not insignificant burden there. And at the very back of my mind, I have some of my very early public health teaching and about the Spanish flu pandemic and what happened in terms of years and years and years later in the States. There was a really big cluster of cases of Parkinson's disease in people who had come through the pandemic flu and had experienced the pandemic flu. And there is a real problem, I think, about exposing young people to this virus, which we know is a deadly virus, and we know it affects people's brains. And here you have the part of our community that has the most vulnerable brains because they're growing, and they are uniquely vulnerable. And exposing them to a deadly virus when we don't know anything about the long-term potential consequences of this. So we should not do this lightly. We should not be exposing our children to the possibility of viral infection of this nature lightly.
No. Siobhan Aston, Dr. Gabriel Scally, Sarah Grant, we are at the end of our time. Thank you very much for taking part in this show today. It's very much appreciated, and thank you very much for supporting alternative media.